All right. Hello, everybody. If you're not familiar with me, my name is Dr. Robert Duff. I'm a clinical psychologist from Southern California. And today I want to talk about a topic which is, should therapists and psychiatrists, mental health professionals broadly, should they have religious symbology in their offices? Should they have art or different types of items that signify their religious affiliation in their offices? And this is a topic that was prompted by a blog, a Medium post by Cody Harmon. Now, Cody is somebody that I follow on social media. We've been, talking back and forth on there, and he's somebody who has gone through my Kick Anxiety's Ass online course. He's a personal trainer, I believe, bodybuilder, and a transgender man. And with that has some very, very interesting experiences, very open about his transition, surgeries, all of that sort of thing. Really inspirational dude. If you don't follow Cody, I definitely suggest it. I'll put all of the links to his stuff in the description for this video. But he wrote a post on Medium called "I Can't Escape." I don't know everything about Cody, but I do know that one of the things in his background is kind of some fundamentalist religion, trouble with, being discriminated against because of, being transgender and other issues. So definitely religion is something that's sensitive to him. And he wrote a post on Medium about going to a psychiatrist and encountering some religious symbology. And so what I want to do is open up that Medium post, read some parts of it, and then comment on how I feel about the situation and whether I think that mental health professionals should have religious stuff in their offices in the first place. So to start off with, let me pull open that Medium post. I'll just minimize myself right here. So it's called "I Can't Escape." I'm not going to read the whole thing. It is a short read, about 8 minutes, but I'll read a few of the paragraphs, okay? So the first one says, "I saw a psychiatrist for the first time the other day. I've been an avid therapy goer for years now and have dabbled in a variety of anxiety meds, which have all been of little or no help, or just put me through horrible withdrawals and made me vow to never try them again. Personal experience. Obviously, you guys know how I feel about psychiatric medications. Good for many people, not great for everybody. I haven't had the best track record in finding trans-friendly mental health professionals in the past. I live in a small conservative town in Northern California. Yes, there are, in fact, conservative parts of California. This is true. My first therapist wanted to take me to group conversion therapy meetings. Conversion therapy meaning trying to make somebody have a different sexual orientation. So problematic, to say the least. And the first psychiatrist I sought out had me go through an initial screening with a nurse at his practice where I found he prescribed diet changes with a Seventh-day Adventist approach. I couldn't have run out of that office fast enough. I pretty much gave up and figured I would stay cozy with my current therapist and never step foot in a psychiatrist's office again. That is, until my anxiety refused to die down and a diagnosis of ADD was thrown at me. So ADD being ADHD, attention deficit hyperactivity disorder. Some people have predominantly inattentive, so head in the clouds, trouble focusing. Some people have predominantly hyperactive, trouble controlling behavior, inhibiting behavior, a lot of energy and stuff like that. Some people have combined. So, the next paragraph basically talks about how his physician clued into the fact that he might have been, living with ADHD, and it wanted to refer to a psychiatrist. And in this paragraph here, it says, "To my dismay, the Ritalin, being medication for ADHD, was denied by my insurance multiple times, and my insurance preferred the prescription come from a mental health professional. Luckily, I had an upcoming appointment with the psychiatrist I was referred to, so I figured they would probably help me out and get my insurance to approve it. So nervous about the appointment. Day arrives. Immediately upon walking in the door, I was hit with a whoosh of air, and I noticed a certain smell. It wasn't a usual doctor's office smell or even an office smell. I was about to have a weird experience smell. It smelled like church. I approached the receptionist's desk where there was a white Gideon Bible sitting right on top of the counter. So Gideon Bibles, I think, are those are the ones that you have at in the hotel rooms and things like that. You couldn't miss it. It was purposely placed there for all to see. As a former Christian with about 1,001 Gideon Bibles of my own gathered through my religious years, I knew the purposeful placement of that Bible. So obviously that was there for him to see. So obviously felt a bit dismayed, but he says here, I was on a mission to get some help for my anxiety brain, and I had already driven 40 minutes to hopefully get the prescription I'd been waiting for. I had purposely made sure to wear long sleeves to cover my arm scar from phalloplasty in case a scenario like this took place, which that in itself breaks my heart. So phalloplasty, obviously, bottom surgery related to bottom surgery and taking tissue from a different place in the body, which in this case is his arm. So covering that to hide the person that he is, feeling that he has to, that sucks to hear in the first place. But I certainly get it. If you take a look at Cody at this point, obviously, if you're just walking down the street, you wouldn't necessarily have any idea that he's a transgender man. But still, things like this make you feel like you need to hide. Definitely didn't want the doc to know I was trans. Thanks, anxiety, for saving my ass on this one. Good point. So time goes by, gets pulled back into from the receptionist into the room. Without saying a word, he led me back to his office. I'd never been to a psychiatrist before, so I didn't really know what to expect. Would it look like a therapist's office or a doctor's office or some sort of weird hybrid? I'm still not quite sure what a psychiatrist's office looks like, because this one looked like a Sunday school room. Upon entering it, there was a large round white table with white chairs placed all around it. He told me to have a seat, and then he sat across from me with his MacBook in hand. My eyes immediately started scanning the room. There were numerous religious pieces of art, a few of Mary, one of another priest-looking one, and one on the wall right behind the doc's head was a crucifix. Fuck. He began taking a history and asking me questions about my medical issues and what else I had been diagnosed with. I told him anxiety, but that's all I was willing to give. If he can believe in a sky daddy, I can believe I'm a cis man just seeking help for my loud brain. Love that sentence, by the way. So they go through and, other stuff, asks if he has any sort of faith. He says no. Actually, there's some good stuff I should read here because it really points out how this can be very impactful for certain people. He asked about my family, if I was single or had kids who I lived with. Then he asked if I had any religious beliefs. As I looked up at the bleeding Jesus on the cross behind him, I gave him a stuttering no. I winced, thinking the doc was about to pull out another Gideon Bible. I can't tell you how many times I heard stories as a kid of people being held at gunpoint asking if they were Christian, and they ended up being martyred for their faith. As a person with anxiety, I played out the gunpoint scenario in my head on numerous occasions. Surely I would never deny Jesus. I would take that bullet for Jesus, my homeboy. Wow, has my life changed. I was afraid to be persecuted by faith, not because of my faith. Luckily, no bullets or Bibles flew, and he moved on. So he goes through and talks more about this. Eventually, not getting the prescription that he wanted, using GoodRx to get a coupon for it, the experience of going on Ritalin, some stuff like that. But the primary reason why I want to talk about this is, he had posted on social media, asking, actually, I think he tagged me in it saying, like, is this normal, right? So is it normal for a mental health provider, especially a psychiatrist, so a medical doctor, to have symbols of their faith in the office? And this is something that I do get a lot, and I have some opinions about it. The first thing that I'll say about it is that it's a choice. So this is a choice that therapist or psychiatrist, that mental health provider is making. There's a lot of choices that you make when putting your office together, when sort of putting your space together, what sort of things you're going to have in there, things that are relaxing, things that are vibrant, things that are cultural. It's a choice. Now, in some cases, this choice may be intentional and helpful, right? One thing to consider is that for many different types of people and in certain areas, religious symbols might be more cultural, right? So rather than being, say, an overt statement about this person's faith, it may be culturally appropriate for the area that they live in, and that's going to make most of the people that come see them feel inherently more comfortable. I'm thinking places that are, for instance, highly Catholic. A lot of times you will see in doctors' offices or therapists' offices a little bit of that imagery just to make it seem like it's a place that they can be comfortable in. And a lot of these people might have a little bit of hesitation to see a mental health provider, and seeing something that's comfortable to them will help them kind of get over that hump. But if you're not in that sort of situation, like Cody was not, if you're just simply referred to somebody and then you're smacked in the face with religious symbols, that can be really hard. In some cases, that can even be triggering for trauma. If somebody's been traumatized by the religion that this person is exuding, that can make them defensive, or as I said, a bit triggered by that, maybe having a hard time with their PTSD symptoms or simply just feeling a lot of anxiety. So it's a choice that the doctor, that the provider is going to make. Another way that you could think about it is if you were to switch this and make it political, right? In general, you probably would think that it doesn't make much sense for a mental health provider to have political things in the office. Well, that in general probably is true. However, what if, so take Cody, for instance, or a lot of other people that I know, maybe they're trying to see somebody who is LGBT friendly and who has political ideals that, are in line with their life. And so having certain things in there, political organizations, maybe stickers or different pieces of art that make it clear that they are on their side politically, would make them feel a whole lot comfortable and a lot more forthcoming. So in a way, it's sort of a way that you can screen for and screen out certain types of clients. You're not going to be helping everybody, and that's okay, right? And I think that as you go down into different types of care, right, like a GP, a primary care physician in a large healthcare network, probably wants to be a bit more comfortable about this, a lot more neutral, because they're going to be seeing everybody. When you're talking about a specialist, when it comes to mental health, it's becoming a little bit more specialized, and maybe there's a little bit more room for expression, but it is a choice, and you have to recognize that. Now, I think that if you do make that sort of choice to put overt signs of your faith, of your politics, whatever, into your office, I think that you need to make that clear in your literature as well. So things like your website, brochures, when you talk to other organizations, like say I'm going out to doctors in the area and kind of saying, hey, you can refer your patients to me. I do therapy, I do testing, blah, blah, blah. If I were a religious-based professional, I would want to tell them that so that people aren't blindsided, because when you're blindsided, you're not going to get the right standard of care. So that's something that should be put out there in the, like I said, websites and literature that you put forth into the world. When you're doing things like making a Psychology Today profile or getting on any of the websites where you can search for a provider, there is a little checkbox where you can write if you have a religious affiliation or a religious bent to the type of services that you give. And that's really important, if to be honest about that. My wife has an example that she's talked about where she was referred from her, I think from primary care, to go see a therapist. And she comes into the first session, and sitting across from her, this therapist is holding a mug with a Bible verse on it. And to her, that made her very uncomfortable. And we are people who are, we're agnostic or atheist, sort of as a family. We don't have a particular faith. A lot of things related to Christianity, especially, missionary work and the history of it, we have big problems with. And so when there's a Bible verse staring you in the face and there's something you want to talk about, especially say the problem is with people from that faith or something, you're not going to feel comfortable with that. And so the session is going to be very, very limited. So at the very least, I think it makes sense to either keep things more neutral or be upfront about what you're putting out there. Doesn't mean you can't, but just like everything in therapy or in mental health treatment, it's a tool. It's something that you're using intentionally. I think that this example is a bit on the extreme side. Having a Gideon Bible right there on the receptionist counter is like, hey, this is who we are. And then as you go, you're seeing more and more and more of the art. And if that's something that you're not comfortable with, holy crap, you're not going to be feeling very good about that. So this is an organization, practitioner, whatever, that I think should be much more upfront about the fact that they are a religious therapist. And if they're not trying to do that sort of treatment, then tone it back. There's a big difference between maybe having a crucifix, a small crucifix on the wall near where you write your notes versus everywhere and right in somebody's face, and in a way, almost like trying to push it upon them. So those are sort of my off-the-cuff feelings about it. I want to know how you feel. Have you encountered a situation like this, whether it's religious or political affiliation, anything that has been sort of broadcast by a mental health provider you've been to, and how has that worked out for you? I just want to know more about your experiences with this. So comment down below so I can hear some examples. And how do you feel about this situation that we're talking about with Cody? Let me know.